Since learning you're pregnant, life has been filled with one decision after another, such as finding exactly the right girl or boy's name, picking out every perfect thing for your nursery, and of course, choosing the best hospital for delivering your baby. In selecting one of the locations of Carolina's healthcare system, you've made an excellent decision, ensuring the highest level of care and comfort. And that includes access to the highly trained physicians of Southeast Anesthesiology Consultants, who are important members of your care team. Which brings us to yet another decision still before you: the type of pain control you want to use during labor and delivery. The physicians with Southeast Anesthesiology want you to have all the information you need to make an informed decision. By thinking ahead and creating a plan now, you can help things go smoothly once you enter the hospital. Several different kinds of medications and procedures can make labor and delivery more comfortable while keeping you and your baby safe. Let's consider each of them briefly so you can be informed about your options.
Basically, there are 4 approaches to managing pain at any point during your labor and delivery. First, pain medications may be given through an IV that will help lessen pain during the early part of labor. These drugs are usually narcotics and can make you and your baby sleepy. That's why they're used in the early labor and not closer to delivery.
The second approach is called the local nerve block. The medical term is pudendal block. Local anesthetic is injected to numb the individual nerves that carry pain signals from the birth canal. This block is only done at the time of delivery and does not relieve the pain of uterine contractions.
The third approach is to numb a broader region of the body with local anesthetics placed below the level of the spinal cord. These regional blocks are better known as epidurals, spinals, or a combination of the two. This is the approach chosen by most women who want to participate fully in the labor and delivery process, but who would like to have most or all of their pain removed. Epidurals and spinals are also the most common techniques used for C-sections.
The fourth and final approach is to use general anesthesia for C-section. This option carries slightly greater risk, and it is used only when there is no time to place a spinal or epidural, or when the spinal or epidural is not solid enough for patient comfort. Also, in rare situations, general anesthesia is indicated because of the patient's medical condition.
Since epidurals are most often preferred, let's talk about how they work and how they're administered. Physicians with Southeast Anesthesiology Consultants perform thousands of these procedures every year and can provide some important insights.
An epidural is really an amazing procedure. It relieves pain by interrupting pain signals so they can't get through to the brain, the center of the nervous system.
How soon can I have an epidural?
When to begin the epidural is a very individual matter, and it's a decision you'll need to make with your obstetrical caregiver and anesthesiologist. It is usually administered when you are having regular contractions and your cervix is dilated 4 or more centimeters. This decision is also influenced by your medical condition and the condition of your baby. It's crucial that you let your labor nurse know what your pain level is so that your epidural can be started as soon as you really need it. An epidural goes into a very specific place along the spinal column so that only certain nerve signals in the lower body are blocked. To administer the epidural, we'll ask you to sit or lie on one side with your lower back rounded out like a rainbow. This opens the spine and makes it much easier to slide a thin needle between the vertebrae. Next, we'll wash your lower back with a sterile solution and numb the skin with local anesthesia.
Is this gonna hurt?
When we numb your skin with local xylocaine, you will feel a brief stinging sensation. Luckily, the ligament between the spine does not have any pain fibers, and once the skin is numbed, you will only feel pressure as the spinal needle is advanced. When the epidural space is located, we'll thread the epidural catheter in and tape it to your skin. This catheter is very small and flexible, so you can lie on it or change position without difficulty. We prefer that you lie with your hip rolled slightly to one side so that the baby does not rest on your major blood vessels and cause your blood pressure to drop.
The timing of the epidural placement is determined by your medical condition, the progress of your labor, and your wishes. This is why communication between you and your caregivers is very important.
I want to go as long as I can without an epidural. When is it too late?
Once your cervix is completely dilated, and your baby is coming down the birth canal, you will feel a strong urge to push. At this point, it could be too late and not necessary to have an epidural because your delivery is imminent. You should prepare to push when asked and know that delivery and pain relief are at hand.
How long does the epidural take to work?
It takes about 5 to 10 minutes or 2 to 3 contractions after your anesthesiologist injects the initial dose of medication before you feel a marked reduction in the intensity of your pain. You may feel warm and tingly from the belly button down, and your legs may feel wobbly or doughy. Sometimes the numb feeling reaches a little higher to the ribs, and that's okay.
Will I have complete relief of my labor pain?
Epidurals sometimes require adjustment. That is why there's an anesthesiologist dedicated to the OB floor 24 hours a day, 7 days a week. Sometimes the epidural will set up on one side well, but not the other. This can usually be remedied by giving an extra dose of local anesthetic after turning you with your uncomfortable side down to let gravity pull the medicine to that side. Sometimes we need to pull the epidural catheter back a little and inject more medicine so that the block will even out. Occasionally, we simply replace the catheter. Epidurals will usually cover all or almost all of the pain of the first stage of labor. That is, the pain of the uterine contraction, which is felt in the lower abdomen. However, when the transition occurs and the baby comes down the birth canal, you will feel pressure on your bottom, vaginal or rectal. We do not want to take all of this pressure away because it will help you push the baby out. But we can make it manageable by injecting more medicine into the epidural with you sitting up to let gravity carry it to your bottom.
It takes years of training and experience for physicians to become expert at giving epidurals and monitoring patients throughout the birth process. Let's check back with Chandler and Dr. McGuire on more questions about her epidural.
Will it wear off before I've delivered?
No. You see, we infuse an anesthetic solution through your epidural catheter until you have delivered. After you have given birth, we remove the epidural catheter, a process that doesn't hurt.
But how long will it take the block to wear off after I've delivered?
It usually takes about 2 to 3 hours before sensation and muscle strength return to normal.
Will the epidural slow down my labor?
The effect of epidural analgesia on the progress of labor is variable.